leaders for all the great work that you do day in, day out in this city. And first of all, we need to give you a round of applause for that. With our partnership with Morgan State University School of Community Health and Policy, also I want to acknowledge, share our strength, an organization that has been a committed partner of ours to address the issues as it relates to food insecurity. We are glad to be able to announce 21 recipients receiving over $200,000 in grants. Leaders. For the city of Baltimore, not only to create healthy spaces for children, but also for the community as a whole. You as the leaders answered the call. You answered the call to create very innovative projects. Is that me? That's not me. Okay, I just want to make sure that was my too. Create and strengthen innovative projects that would address issues in terms of public safety, education, housing, employment, and transportation without the benefit of a formalized organizational structure. Now, for Family League, we've been around for 30 years. We're deemed as a local management board for the city of Baltimore, which means that we take dollars from public sources, whether it's the city of Baltimore, the state of Maryland, also the U.S. federal government, and we give those to community service providers. In a lot of cases, those community service providers don't look like you or me. In a lot of cases. We made an intentional effort to be very conscientious about equity. And if you want to know what that means, it is in terms of when you're talking about the distribution of resources to people as well as communities that have historically been marginalized, exploited, discriminated, excluded, all the other things and isms that you can come up with for a very long time. And as you look at the system, it just becomes exacerbated and compounded over the length of time. But because of our partnership with Morgan State University, we embarked on a course to say, hey, we want to look at doing things a lot more different in the city of Baltimore. We started, one, with a partnership to do research. Each 4 years or 5 years, organizations like us throughout the state of Maryland are called to do what you call a community health needs assessment. Basically, it does a scan in terms of all the different things in terms of the barriers, the issues, the indicators as it relates to the communities within your local jurisdiction. That's us here for Baltimore. We were approached by a number of folks who said, hey, we'll do the community health needs assessment, we'll pull up the numbers and the data for you, and we'll just do the things that you've always done. Has it made anything better? Why would we continue to do the same thing, the same way that we've done all the time? So, we reached out and said, hey, you know what? Who can we partner with as a part of this project? Not the same folks, not the Johns Hopkins, not the University of Maryland, not the University of Baltimore, but how about the leading historically black college university that's known to be the largest urban research institution, not only in the state of Maryland, but some would say in the country. That's right a stone's throw away from our headquarters. It makes perfect sense, right? So, when we embarked on that path, I reached out to the School of Community Health and Policy and spoke to Dean Demaune, and she said, hey, what you want to work with us? Really? Do you really want us to tell that story about the history of Baltimore and redlining and all the issues and the challenges and the barriers? Young man, you want to still keep your job? I said, well, ma'am, quite frankly, for the shoulders of the grace that I stand on, I wouldn't have any business in having it if I can't go out and tell the truth. So the research was done, and we were fortunate to have Dr. Lawrence Brown, who's also here this evening, to help with not only we had the quantitative analysis, which you're looking at the numbers, but also what they call qualitative analysis, which is actually hearing community voice. That's the thing that's always missing. So when I was talking to the University of Maryland and the University of Baltimore, and I said, hey, I want you to go out into the community and speak to people. What? You want us to do what? You want us to talk to folks? No, we'll crunch the numbers. No, we want you to reach out to community partners and hear what they have to say. And Coach Doc responded to me, not Morgan. Morgan went out with the graduate students and heard directly from community in terms of what they wanted to see. And one of the top recommendations was, let's look at an adaptive village model that's really able to support with a low strings attached, grant-funded program that allow us to do what's in the best need for our communities, because we know it better than you.